Let's go live to Cairns. Joining me is the National President of the Pharmacy Guild, Trent Twomey. Trent, thanks for being on the program again. Yesterday, you and I were talking about something you raised. An emergency measure known as the continuing dispensing instrument enables pharmacists to give people their scripts without having a script, give them their medicine. Now, I've asked the federal government. They say that they are considering this matter urgently. However, at the moment, there are provisions for 3-day emergency medicine supply without a prescription. What's your reaction to where the federal government is right now?
Well, yesterday when we spoke, Kieran, I was on the floor of my dispensary. Today, I'm in my office trying to get medication out of wholesalers into pharmacies, while my pharmacists are trying to get medications out of their dispensaries and into patients' hands. And if you have lost your prescription, the physical bit of paper, or you've lost the box because you've completely lost your whole home, the last thing that you need to be worried about is red tape. Now, to tell frontline healthcare providers who didn't shut other than that one day at the peak of the floods that they need to take a box off a shelf, remove a sleeve, get a pair of scissors, cut out 3 tablets, label a box, give it to the patient, and tell that patient of all the things they have to worry about. They need to go and find an appointment with their doctor to bring back a little green piece of paper to me, because that should be their biggest concern. It's just nonsensical. And there was this really sensible reform, Kieran, that was in place in the bushfires, that was in place during COVID-19, that simply said, if your GP has prescribed you a medication, it is by definition essential. It is not a discretionary item. If you have lost your home, if for whatever reason you can't get an appointment, you just need to go and ask your pharmacist, and your pharmacist can give you one box to tie you over. Now, this was turned off, and to me, and I have no doubt to you and a lot of your viewers, this was just a sensible reform. There were hundreds of thousands of times this was done over the course of the pandemic and the bushfires, and not one adverse occasion of service where something went wrong. And this sensible reform was switched off. So we've asked them to switch it back on.
Trent, well, the government says it's urgently looking at these arrangements and will have more to say. What's your message to Mark Butler and the federal government then this afternoon, given they've told me today they're urgently looking at the arrangements and will have more to say? What's your message to them? Well,
you know, when I've had 6 inches worth of muddy floodwater through my wife's pharmacy, when I have pharmacists, and that's in Innisfail, when I have pharmacists in Kuranda who waded through floodwaters and dispensed prescriptions by the light of a lantern, and when I've got pharmacists who are completely lost in the communities of Mossman and Port Douglas and are trying to do deals with tourism operators that are now no longer operating to freight essential medicines from Cairns up by sea, you know, I think we could do this a little quicker in Canberra, Kieran, just a little bit quicker. No one's asking for money. No one's asking for a handout. We're just asking for a little bit of red tape to be removed so we can keep people on the medicines they're being prescribed.
What about the other thing that they've told me there that is in place? Basically, those 3-day emergency medicine supply, which we referred to, you've obviously criticised that, saying that your members can't go out and your pharmacists can't go out and simply just spend their time cutting up a box of medicine. But what about owing prescriptions? Owing prescriptions, does that fly for you? Basically, where a GP, a doctor's got to send within 7 days the script to the pharmacy. Is that doable?
So that's exactly what we're doing. But do you know what an owing script is? An owing script doesn't just mean we will give you the box and wait for the poor doctor. And the doctor's flat out too, right? I mean, they're trying to reopen their surgeries. It also means the feds aren't paying you. And what the feds are saying is, listen, you give it out, you pay for it, you give it out at your expense, pharmacist, to the patient, and just issue an IOU to us, and eventually we'll get back to you. Well, you know, I don't know how you're asking frontline healthcare providers to cover the cash flow requirements of the pharmaceutical benefit scheme. That is exactly what we're doing, though. I mean, there's no way Georgina and I are going to ask a pensioner to cough up $60 for something they usually pay $6 for. But you know what? It's not really right that each community pharmacist turns into a not-for-profit charity and puts it on the tab. But that's exactly what they're asking us to do, and that's exactly what we're having to do, unfortunately.
Have you got any sense that the government might come to the table and put in place the same measures, as you say, that have been in place during COVID, during the fires? What, as you raised with us yesterday on this program, it's called the continuing dispensing instrument, that ability for you and your colleagues to give the pensioners, others affected, their medicine, give them a box of their medicine so they don't have to worry about it.
Listen, I have no doubt it'll happen. It's just unfortunately happening at what Canberra refers to as lightning speed, and the rest of the country thinks is a snail pace. This is reform that isn't just needed up in my neck of the woods after a natural disaster. This is reform that should just be in place as a matter of course, whether it's, at 10 o'clock on a Friday night where the pharmacy's open and your GP's not, whether it's on Boxing Day, which is about to happen in a week, New Year's Day, which is about to happen shortly thereafter. Every viewer will have an example of either themselves personally, Kieran, or an extended family member that, not because they are lazy or because of poor planning, it's just because of going about everyday life. They thought they had an extra sleeve in that box, or they thought they had an extra repeat on that prescription, and they shouldn't go without essential medicines, simply because it's taken too long for Canberra to react.
So what's the historical legacy of this? Like, why is this the position? Is it the doctors' lobby that demands that they have the final say on who gets medicine? Is it a lack of trust in pharmacists? What is it?
It is a new thing. I mean, it didn't exist a decade ago. It was first rolled out over a decade ago just for cholesterol-lowering medication, and then we added in the oral contraceptive pill, and then it went for all medicine, other than, of course, drugs of abuse, right, Kieran? So opioids and benzodiazepines, so sleeping tablets, and things that can be a drug of abuse, they are quite rightly excluded from this mechanism. We're talking about diabetes medication, high blood pressure medication, stuff for arthritis, things that are not drugs of abuse but are chronic diseases that someone's going to be on next week and next month and not magically going to need to go off it. It was genuine reform that was put in during COVID-19. You would have thought as a country we would have reflected on all of the good things that we did to remove red tape, just get on with the job through the pandemic. It was turned off, you're right. Some of the medical lobby group doesn't like it. Local GPs don't have a problem with this at all. But, some of the medical lobby groups don't like it. I don't know whether they've got in the year of Canberra or not. I've got no proof of that. I just, while there's all the other things, broken highways, flooded streets, lack of fresh water and all that stuff that I know the Premier's up there today talking about and the Prime Minister's going up in the next day or so to talk about. This is just something pretty basic, right? Pretty basic that would make a big difference to healthcare in the north at the moment.
It does seem like a no-brainer. And as you say, local GPs would be all over it because it takes a bit of the heat off them as well. Let me just finish, instead of Trent Twomey, President of the Pharmacy Guild, tell me as a Cairns resident, what's the city like? What's the community like at the moment? How's it holding up?
Listen, I've never been prouder to be a Far North Queenslander. We're a stoic bunch, a resilient bunch. We don't want handouts, but, we do need a bit of a help at the moment. And as I said, I know our state Premier is in town. I know our Prime Minister's coming up, and it's all headlines at the moment. And as those waters dissipate, we just need to make sure that the attention Canberra and Brisbane are going to be applying to the many months ahead they're going to be required for rebuilding don't dissipate as those floodwaters do. So, as I said, we're a bit of a frontier mob up here in the north. We don't really like government intervention at the best of times, but you know, we are going to need some help. It's going to take many, many months. And my wife and I and our two children, luckily, we're very safe. Our house is high and dry, but we've got many patients who have just lost everything, Kieran.
Yeah, it has been such a shocking way to finish the year in a beautiful part of our nation, Far North Queensland. Trent Twomey, National President of the Pharmacy Guild. Appreciate it.
Thanks, Kieran. Merry Christmas.